Preventing treatment of behavioral emotional disorders and group music psychotherapy in correctional psychiatry. So, to start off, they usually use the term emotional behavioral disorder, and then these are the things to consider for formal diagnosis: frequency, duration, and intensity. DSM-5 stands for Diagnostic and Statistical Manual of Mental Disorders. As for the causes, it can be physiological or environmental. In behavioral emotional disorders, they usually vary in terms of the type, its causes, the symptoms, the severity, and of course the course or duration. Can be once, episodic, and chronic. Now let's start with the first type, schizophrenia and other psychotic disorders. So schizo is a splitting of the mind, not a splitting of the personality. So there are disturbances in thinking, feeling, and actions. So they have alterations basically. They also experience psychotic proportions in which they will suffer from loss of contact with reality and self-perceptions. So the symptoms includes hallucination, delusions, disordered thinking, movement disorders, flat affect, social withdrawal, and cognitive deficits. For positive symptoms, so delusions basically are false beliefs that lack a basis in reality, but they are maintained by the patient despite having no evidence. Like, for example, delusions of feeling grandeur or persecuted. And then hallucinations are sensory experiences in absence of actual environmental stimulation. So they they hear voices or see things that don't exist. And then disorganized speech, making effective communication impossible. And then grossly disorganized behavior or catatonic behavior in which they cannot do ADLs anymore. And there's also a marked abnormality in motor behavior. For negative symptoms, so there's a deficit or decline in spatial affect, speech, inability to do and sustain goal-directed activity, apathy, and social withdrawal. As for the treatment, so there are antipsychotic medications, therapy, hospitalization, ECT, psychosocial therapies, and of course, music therapy. Another one is mood disorders. So it is a class of BDs and characterized primarily by disturbance in mood. So it could be extreme elation or depression and is organized around different types of episodes. So it is not a personality disorder. As for the episode, there are two, depressive and manic. So depressive, basically they have persistent depressed mood and symptoms may initially develop at the time of personal crisis and will persist over time beyond the normal time of mourning. And then comparison with the clinical depression, so people with clinical depression can also feel depressed with no apparent reason. And then for the manic episode, so they become extremely talkative, inflated self-esteem, and all that. Bipolar is a mood disorder, so there's mood swings, impulsivity, anger, and anxiety. So usually what makes up a mood disorder is having to experience both. As for the treatment, there's psychotherapy or talking therapy, ECT, medicine, music therapy, or increasing BDNF. Next is anxiety disorders. So it is a group of diagnoses which is characterized by unrealistic or excessive anxiety, panic attacks, or avoidance behavior. So these are basically normal response to stresses of everyday life, but becomes excessive, irrational, and debilitating to everyday functioning, including physical symptoms such as racing heart, dizziness, chest pain. As for the treatment, there is CBT, cognitive behavioral therapy, which focuses on changing catastrophic or rational thoughts that trigger anxiety. For example, teaching techniques that reduces fear response. Another one is medication, stress management, teaching relaxation techniques, support groups, and music therapy. So there are 5 types listed, however, I added other things. So let's start with GAD, general anxiety disorder. So it is a chronic anxiety with exaggerated worry and usually occur with little or no provocation and accompanied with physical symptoms. Next is OCD, however, it is removed under the DSM-5, but to define it, so it is a recurring unwanted thoughts and repetitive behaviors, or repetitive behaviors, and doing compulsive rituals to cope with their obsession. Panic disorder, so it is an unexpected and repeated episodes of intense fear accompanied with physical symptoms, and there's a sense of unreality or fear of impending doom or loss of control, and can come with no precipitating event. PTSD or post traumatic stress disorder usually develops after traumatic event. Then social phobia or social anxiety disorder, so there's an overwhelming anxiety, excessive self-consciousness, fear of being judged or being embarrassed, and then it may occur only in specific situations. So I added specific phobia and separation anxiety. Specific phobia are like fearful feelings about a particular object or situation, and then separation anxiety is a common emotional response. However, it becomes excessive, and then usually it is a distress when separated from a primary attachment figure, and is often seen in children but can also affect adults. Next is personality disorder. So the individual exhibits personality traits that are so extreme, so inflexible that causes difficulty in school, work, relationships. These differences deviate in cognition, so on how people perceive and interpret themselves, others, and events, the affectivity, the range, intensity, the appropriateness of the emotional responses, in their interpersonal functioning and impulse control. So there are different clusters. So there are three clusters: cluster A, B, and C. So let's start with cluster A. Cluster A is called odd or eccentric. So these are just some types under the cluster A. Paranoid personality disorder. So there is a pervasive pattern of unwarranted distrust and suspicion of others, interpreting all the motives is malicious or bad. And then for next is schizoid personality disorder. So it is different from schizophrenia. So they do not experience hallucinations, but they prefer to be alone and detached, and are not always moved by emotional connection to others. Another one is schizotypal personality disorder. So there is a presence of strange beliefs or fantasies, and may have very passionate ideas about things like outer space or other worlds, making it hard for people to relate to them. So example is Willy Wonka. For cluster B, so here, dramatic, emotional, and erratic. So one type is antisocial personality disorder. So not in the sense that it is like they generally don't like people, but they blatantly disregard the rights of others. In most serious cases, these include psychopaths. They are aggressive, lack remorse, and use deceit to get the things they want, even at the expense of others. Next is narcissistic personality disorder. So it is characterized by inflated sense of self-importance, a deep need for admiration, and lack empathy for others. And then histrionic personality disorder, it is characterized by seductive or overtly emotional behavior. If they do not get the acceptance or validation that they crave, they may get passionately upset and display dramatic behavior. And then borderline personality disorder, so it is characterized by mood swings and other erratic behaviors. So they may engage in risky activities, be aggressive toward others, and this disorder mainly stems from unstable relationships they have with others in their lives. One moment they really like a person, and then the next moment they have very angry feelings for that person. For the last cluster is cluster C, anxious, fearful, and avoidant. So the first type, avoidant personality disorder. So there are fears of rejection that may cause them to completely withdraw from society and experience prolonged feelings of anxiety or fear. And then OCPD, or obsessive compulsive personality disorder, it is different from OCD. People with OCPD, they are not under the control of the impulses or behaviors, so they do not flick the lights a number of times or take specific amount of steps from one room to another. However, they become preoccupied with perfection and may lose sight of what they were doing in the first place. So they want to abide with the rules and become obsessed with making lists or organizing details, and these tasks may get in the way of forming relationships with others or understanding the objective of an activity. And the last one is dependent personality disorder. So, as a child, it is normal to experience separation anxiety. However, there are adults who don't outgrow them. That's why they may develop DPD. As for treatment, can be outpatient treatment, psychoanalysis, counseling, medication, psychotherapy, and music therapy. Next is substance-related and addictive disorders. So these are like drug abuse, toxin exposure, side effects of medication, and maladaptive behavior leads to significant impairment or distress over a 12-month period. So there is a 12-month duration. There's two types, substance use and substance induce. So substance use, there's dependence and abuse of it, and then induce are effects like intoxication, withdrawal, and induced psychotic disorder. So these are problems in face. Substance tolerance, they need higher dose not to get desired effect. Addiction, it becomes a priority. Intoxication, so they develop a substance-specific syndromes of mental and behavioral disorders, and withdrawal, which are the effects of stopping the substance use. Other problems include decrease in social, occupational, or recreational activities, physical problems, problems in sleep and sexual functioning, erratic mood swings, hallucinations, and other disturbances in perception, cravings, tolerance, withdrawal. As for the treatment, so there's group therapy, behavioral therapy, detoxification and inpatient treatment, self-help groups, pharmacological interventions such as methadone or antabuse, music therapy, and counseling. Other psychiatric disorders, so eating disorders, so here it affects your relationship with food and how you see yourself. There are different types, so anorexia nervosa, so here basically self-starvation and the fear of gaining weight and a distorted self-image. Bulimia nervosa, on the other hand, you binge eat and then after that is you vomited. There's a purging in a way, and use laxatives, or these are medication that makes you poop, or exercising excessively. And then binge eating disorder is you also binge, however you don't need to vomit it. So you are followed by feeling shame, regret, guilt, or depression. And then pica, so you compulsively swallow non-food items such as chalk, dirt, or paint. To continue with the eating disorders or rumination disorder, so undigested food returns to a person's mouth after swallowing it. So it's rechewed and reswallowed and then spit out. And then RFID or avoidant restrictive food intake disorder, so they limit the amount or type of food they eat for reasons unrelated to distorted self-image or attempt to lose weight. Then another disorder is somatic symptom disorder. So a person feels distressed, significantly distressed about physical symptoms and has abnormal thoughts or feelings and behaviors in response to them. It usually disrupts their daily functioning and quality of life. So there is a physical symptom in there. Comparison with the illness anxiety disorder, so they are preoccupied and excessively worried about having an illness or getting an illness. And then conversion disorder or functional neurological symptom disorder, so there are symptoms but there's no evidence of physical or neurological causes. So the symptoms can affect your perception, sensation, or mobility. Philosophical orientations in psychiatric treatment. So first, treatments that focus on affect. So here we have psychotherapy, using doing free association. So basically they explore subconscious level and access the past. So you can use guided music listening, guided imagery, improvisation. And then for behavior, so you can do reinforcement or conditioning. And here, the environment and behavior plays a key role. And then cognition, so you can use CBT or rational emotive therapy, cognitive therapy. So here they emphasize the importance of the process as determinants of behavior instead of the past or feelings or behavior. And then for physical factors, they use biomedical model. Here they examine the role of the brain function in all aspects of behavior, biochemical imbalances, neurological abnormalities, genetic problems. And then milieu therapy is basically creating a safe and structured environment. And then eclectic orientation is the use of variety of models or approach. Categories of music therapy activities. So you can do listening and responding to music, playing and composing music, moving to music, music combined with other expressive arts, music for recreation and enjoyment, and then music and relaxation. So there are different levels of group therapy based on client's functional level. Supportive activity oriented music therapy, re-educative insight and process oriented music therapy, and lastly, reconstructive, analytically, and catharsis oriented music therapy. So let's start with supportive activity oriented music therapy. So it is the most simple one because it maximizes participation with varying functional levels. That's why your activities should be simple because needs active involvement of all individuals with different functional levels. And then so you can do group singing, playing musical instruments or musical games. And you can also reflect back when something happens to the client when there's negative behavior occurs but there is no discussion for the reason. For educative insight and process oriented music therapy, here you can discuss na. So there's active involvement still but with greater emphasis on verbal reflection and processing. So there's problem solving, and then they should also be capable of gaining insights and reorganizing values and behavioral patterns so they are aware of their behavior and then also the behavioral changes that they need to do. So they should be well oriented to reality as well and able to communicate more than superficially. The therapist may wish to identify one feeling that they have or share the feeling with the group and try to determine one event that has possibly contributed to that feeling. Lastly, reconstructive, analytically, and catharsis oriented music therapy. So here they need to be high level. So they need to have good reality orientation, high level of motivation for personal change. So we use this one to uncover, relive, or resolve subconscious conflicts. So music is used to help elicit images or reconstruct past conflicts. You can use also improvisation and then psychodynamic music therapy. And these are just some side notes and things to consider when you do the therapy. The diagnosis, philosophical approach, the level of psychosocial functioning, therapeutic need, maturational development, chronological age, and cultural background. Now for the group music psychotherapy and correctional psychiatry. Now let's define correctional psychiatry. So it addresses mental health needs of individuals who have been found guilty and sentenced by the courts and have a psychiatric diagnosis. In comparison with forensic psychiatry, they provide evaluations of prisoners and treating patients with criminal records who have been found guilty for reasons of insanity. And it usually works outside of prisons in special wards of regular state hospitals. Now, let's define group music psychotherapy. So it provides a structured and therapeutic outlet for emotional expression, social connection, and insight within highly controlled environments. That's why in correctional settings, there must be a balance between clinical goals, security requirements, and professional ethics. So the goal here is to provide a musical experience which is a healthy real-life experience which do not exist in their current environment. Sometimes it is used to motivate severely disturbed patients to re-enter reality. As prison healthcare increasingly mirrors community mental health, crisis stabilization is prioritized, then programs focus on brief therapy with functional goals. It must show immediate impact like reduced aggression or improved mood, and then documentation must support outcome-based models. Here are some common major goal areas in this population: to increase self-esteem, learn how to respect others, provide a means of self-expression, and it should have a theme-centered structure for social interaction and group therapy, reduce aggressive and hostile behavior, facilitate psychosocial development and adjustment, provide a non-threatening and motivating reality focus, induce mood change, promote social interaction and interpersonal support, and promote emotional learning in the following steps. So they have to experience emotions, how to identify it, how to express it appropriately, perceive the emotions of others, and modulate own emotional experiences through feedback from others. Professional considerations for a correctional music therapist. So you must have the knowledge of the typical prisoner's behavior, the power structures among inmates and their manipulative behavior, prison jargon, and the development of different prisoner personalities formed during incarceration. The MT should be responsible for security in their working area, accept the reality of prison setting, and develop adapted techniques. And then less equipment may be available. And then emotional sharing and openness, one should handle it cautiously and may not always be therapeutical. And lastly, be familiar with the criminal record and learn to separate treatment issues from criminal issues. 3 steps to maintain efficient professional attitude. So first, you should constantly realize that small contribution is already has a dramatic difference. 2. Establish yourself firmly as an integral part of the treatment team. Develop supportive interpersonal relationship with the other staff members. And then the intervention should be brief, time limited, focused on the here and now, and guided by realistic, attainable treatment goals and objectives. So you should be firm but also friendly. And then you should always provide immediate, tangible rewards. 3 types of group music psychotherapy in correctional settings. So we use guided music listening and counseling, therapeutic music improvisation, and music and relaxation. So first, guided music listening and counseling, so it's a little bit different. The procedure here is first to describe their current moods, feelings, and concerns, and then ask the patient to formulate personal agenda or a area of concern that they want to address during the session. And then next is to listen to recordings of the music pieces that they selected. And then the music should relate to their personal agendas. And then following each musical excerpt, they are encouraged to discuss feelings and thoughts provoked by the music. And after that, personal interpretation are also encouraged and guided by the MT, and then the treatment goals are formulated for the following days or weeks. Next is therapeutic music improvisation. So the procedure here is to set up a simple jazz type improvisational structure where the patient alternate playing as a group and individual free playing. And then the MT should ensure group discussion focuses on the musical experience as a behavioral learning experience. So here we have a model, musical semantics model. So musical semantics, its literal translations are not musically satisfactory nor therapeutically meaningful. That's why they don't use referential improvisation here. So in music semantic model, so there must be a development of music coherence, development of appropriate behavior, development of transformations of music to language expressions. Lastly, music and relaxation. So the procedure here is first, let them identify the feelings of anxiety, stress, or tension, and the sources of these experiences, and then teach them and apply stress management techniques such as progressive muscle relaxation, and give them the opportunity to discuss their experience after doing the technique during the session, as well as ways to apply music and relaxation outside of MT. So that's it. This is the end of this video, and thank you for listening.